four corners, ancient guardians wake.
Now ending our topics, the general concepts of radiation shall be recalled. The guidelines to safeties and alpha and beta radiation, tissue weighting factors, and accepted practices and standards for the usage to emission of radioactive substances and radiation are set by numerous agencies. They have set the general standard dose of radiation that shall be universally accepted, categorically encompassing samples due to its considerable longitudinal studies. These standards are heavily imposed worldwide. There are specific measurements involved. Some formula involves classical and particle physics. Radiation as a whole, according to references and studies, produces second type of cancers as a late side effect, with the bystander effect and scattering of particles and electrons due to multiple interactions of matter in radiation. It affects normal tissues. Those normal tissues also dies, losing its function and structure. It also causes mutation. Radiation causes mutation in some studies, with consideration to statistical probabilities, also leads to second type of cancer. The 4 R's are a fundamental process of cells in response to radiation that coincides to the hallmarks of cancer. The effects of radiation varies accordingly to different kinds of cells, tissues, and organs. Its acute, chronic, and late effects also varies. It also depends upon the dose of radiation received. It is easily understood to be stochastic or deterministic with proper evidence of statistical studies. Applies to patients also applies to the operators of radiation. The ionizing radiation regulations and medical applied radiation substances regulations are followed as of today. These regulations promote the referral of many healthcare divisions to permit irradiation. Dosimetry measures the estimated amount of radiation emitted and to be absorbed and its effectiveness. FISH is fluorescent in situ hybridization. This is the easiest and cheapest cytogenetic test for cells. Cell lineages are for statistical studies, testing the effectiveness of radiation outside the body. Some formula in dosimetry were guided by standard values accordingly. In radionuclide therapy, mainly used to destroy cells by destroying their repair mechanisms, then following its catalytic pathway to cell death as its primary goal. Radionuclides have many more uses. The linear quadratic cubic model uses a line graph by graphing the dose per fraction to the total dose irradiated in different axis planes. Radionuclide therapy uses radioisotopes or radionuclides that were formed by nucleosynthesis. Nucleosynthesis is the production of elements from a nuclear reaction, generally forming the transuranium metals. Radionuclides also can undergo interactions or decay, forming electrons, photons, and particles. These radionuclides have their specific half-life and energies due to their atomic mass differences. Radionuclides doesn't always produce the same particle due to their differences in shells and subshells along with their spin. Radionuclides can be artificial or natural. Naturally, almost all radioisotopes are rare earth metals. These rare earth metals are not easily found. Their abundance is sometimes different to all places. The 95% of our rare earth metals in the world are from China. Now here in radionuclide techniques, namely ultrasound cyclotron, synchrotron, synchrocyclotron, were not included due to their usage of magnetic field. Your person today included MRI, not supposed to be because it uses radio frequency, because of its precision and popularity as of now. You have different radionuclide imaging techniques that sometimes uses contrasting agents. Your common example is barium enema that I didn't listed. Some contrasting agents are not used anymore due to its risk of damage to the patient done to its effectiveness. Some imaging techniques still uses contrasting agents for added precision to diagnosis. Radionuclide scanning involves tracers, gamma camera, and image reconstruction and interpretation from its retrieved data or computed data. Magnetic resonance imaging involves the interaction of hydrogen from radio frequency waves. It also uses contrasting agents. Now to conclude, the protection of radiation technologies, the 12 principles of green chemistry can be a good general guideline for the usage and disposal of waste of radioisotopes.